Hey everyone, Michael Dudley here. I hope you've been enjoying the patient success stories the past few months under the name Cohort Intelligence, but as of yesterday, Cohort Intelligence is now Engooden Health. I know what you're probably thinking, scratching, what does Engooden mean? It caught me off guard as well. But it's actually a word that's in the English dictionary. It's not used very often anymore, just like other English words in our vocabulary, but it does mean something very impactful. And so I want to explain the definition. It means to take a negative and turn it into a positive, to ameliorate, to improve. And in many ways, that's what we do here at Engooden Health. Specifically, three stand out to me. First, I think about my career and what the EHR industry that I've been a part of for the last 6 or 7 years has done. And essentially, an EHR is just a billing tool. It's creating data entry on these patients' lives, but it doesn't always take the full picture. There's a lot of copy and paste, check boxes, etc. And so we actually have a technology stack that fills in the gaps. So we're able to identify about 23% more care gaps through artificial intelligence NLP technology. And that's great. That's a great tool. But what I think is most important is that our care navigators are able to use that tool to fill in the gaps. So when they're having these conversations with patients, they're able to see on average about 1.4 assessments and 1.1 interventions on these calls with these patients. So when it comes to the data entry aspect of these patients and trying to take a full picture of what's going on with their health, not just what they're dealing with right now in a short term, but what are their long-term goals? What are some ways that we can be able to help them? So in many ways, we're cleaning up the mess that I created in the EHR industry. Two, I work with primary care physicians. I work with independent practices who unfortunately have seen declining reimbursement, FQHCs, etc., ACOs, IPAs, whatever you might want to see. You've seen them having that declining reimbursement. So what do? They either sell to the hospital, they retire, they sell to private equity. They just can't fight for their independence anymore based on the fee-for-service. And so they either need to move to value-based care or find some way to be able to be competitive and improve their revenue. So we actually can do a lot with that. We can actually help groups be able to improve HEDIS measures, to be able to improve how well they're doing MIPS and macro measures, etc. And in the meantime, help them be able to increase revenue on a fee-for-service basis. And so from that perspective, we're turning a negative, literally, turning them from red to black when it comes to that accounting book there. So from that perspective, that's number two. Number three, and most important, is actually helping these patients turn a negative situation into a positive, being that almost everyone, unless you're doing something, your health is going to decline. Unless you are exercising, improving your health, whatever you're doing. So what do these people do? I mean, many of us have parents, you might be in the situation yourself where you just don't know necessarily what to eat. You don't know how to be able to improve your health. And every time you see the doctor, they can only cover so much in their office visit. So they need someone in their corner who can be able to provide coaching, education, and through monthly engagement be able to consistently help them be able to improve their life. So those are the things that we are able to take a negative to a positive, and I'm excited to share this journey with you. So Engooden Health, in good hands, in good health. Thank you guys so much. I look forward to sharing more.